Welcome to the Pets & Co Talk Show with me, Lamia Khan, Ilyas Azam, and Dr. Sarah. How are you doing today?
Very good, thank you.
Very, very good, thank you.
How's the weather treating you?
Too humid, too hot.
It's warm and toasty.
Right, so today's topic, a very, very sensitive topic for all the pet owners out there. Something that we all must be aware of, something that we all must have knowledge of, is the pets' vet emergencies. So we're going to talk in depth about, when is it really the time? Because there's a trend that a lot of dog owners or pet owners, they wait, they ask, they discuss with each other, they go into the groups and they ask, what's wrong with my dog? And then people give their own opinions, which I feel should not happen, because it's the knowledge that they need to have. And then you need to know when is it the right time and it's an emergency, because most of the time they wait on it and it becomes an emergency and then they take their pet. So we're going to discuss in depth, and Dr. Sarah, on the lead, you will help us understand when is it really, an emergency for the pets.
Sure. I think what you've just said there, if somebody has enough time to go onto their social medias, discuss, plan, get 15 opinions from social media, then it's not really an emergency. If it's an emergency, same as you or me, if it's an emergency, get down to the vets. Simple as that, get down there. However, when you talk about emergencies, there are some real and genuine emergencies in veterinary practice, but they're not probably quite as common as you'd think. So bigger dogs, the biggest emergency that you see in big dogs is your gastric torsion, which is a twisted gut. So this happens in dogs, normally big deep chested dogs, your classic, think of the shape of a Great Dane. So that big deep chest, the very narrow tummy in there, and what happens is that you feed a dog like that once a day. They have this big amount of food, particularly either wet food or dry food that swells in the stomach. Then they go, because the doorbell rings, they jump up, they run, and that swinging of the heavy weight of the stomach inside them means that the stomach does one flip too many and twists over on itself.
So it's like there's a lot of advice on feeding your dogs once a day. What's your standpoint on this? I'm starting to make a correlation between, because last month I've heard of 2 cases with large breed dogs that have actually passed away from twisted intestines.
It happens, and it's something that we try and educate, speak to owners about from the time that they're puppies. So we would normally always suggest feeding twice a day, and we'd normally suggest that you train the dog. And again, we could bring you in on this, because this is something that you need to help us with, to train the dog to sit quietly for about an hour's digestive time. Remember, your grandmother used to tell you to sit quietly after dinner? We need to say the same thing to our dogs. Yes. So we actually need them to sit still and let that initial digestion, let some of that food pass from the stomach to the start of the small intestines and just lessen the danger.
Yeah, because I think there's a lot of the practice is we feed the dogs, then we take our dogs for a walk, no?
You feed it and then empty it.
Yeah, so
Yes.
it's the best practice would be to feed the dog, let it rest for a while, and then you start walking your dog.
Exactly, or even the other way around, that you walk your dog,
Let it
you
calm
rest,
down.
let the dog calm down, let it rest, because if you've taken them out for a walk, especially in this heat, then they drink a pile of water.
Yeah.
If you're then feeding them dry food, that's going to swell up incredibly quickly in the stomach, so we don't really want that.
Yes.
To let your dog calm down, settle down, and then feed them.
And this is more for the big dogs, you're saying, because the small dogs, you wouldn't really have that
Small
issue.
dogs don't have that level of swing. They don't have enough space for everything to flip over.
Does that mean that they can eat once a day, or is it the same for them twice?
People always ask this, but I would always, for me, would I manage on being fed once a day? No,
Yeah,
I wouldn't.
I know.
Honestly, 3 times a day, I still struggle. I have to snack between.
And today there's a lot of, because of how things are starting to, look now, most of the information is coming like from social media, right? Yeah. And you have self-acclaimed experts who would go there and how do you say this? Like they would cite studies And then they would say there's a study now that says it's better to prevent cancer in dogs to feed your dog once a day because it's burning things and fat in a certain way, and I get clients sending me these videos and asking me what's our opinion on this. But also, this is like a conversation you would have with your vets, like these citations, still it's...
I think any studies you're looking at like that, if you look at what you call consensus studies, so if you like expert opinion on any topic, then what you do is you have your level of proof. And that's what we should be looking for. I mean, if we looked hard enough on the internet, we could find an article that told us that the sky was green and grass was pink. We could find that.
And the earth is flat.
And the earth is flat. We could find all of those things, and we could find a study that proved it. But the question is that study real? Is that study repeatable? Is that study statistically significant?
Fact checking.
Yes.
Is extremely important, no? And I wouldn't, like for me, if something is applying for a larger breed dog, it should apply to all dogs. Because also I wouldn't want to feed my, let's say, French bulldog just after the dog's heavily breathing and she's been exercise, and then I put food in front of her and she's gonna choke and she can aspirate,
Again, but each breed has their issues. You look at the Frenchie that you mentioned just then. Up to 40% of Frenchies have hiatal hernias. Now, a hiatal hernia is where the hole through the diaphragm, so the bit that separates the chest and the abdomen, is a little bit too big in these guys. And 40% of Frenchies, what happens is that stomach pops into the chest to say hello every couple of days. So, the stomach pops through, that bit of food comes in, and that's why this breed of dogs ends up being a breed that vomits a lot, because the stomach gets in the wrong place, and if it's got food in it, then that food can't go down, so the food has to come up. So it's often seen as regurgitation, and it's crossed between regurgitation and vomiting. But so these guys, if you're feeding that stomach once a day and putting a whole pile of food in it, yes, they're going to vomit more. So, and you look at other breed things like your super small breeds, your tiny little Maltese, your Chihuahuas. They can have problems with, particularly when they're young, they can have problems with how they actually store glucose or store energy in their body, store sugars. And they don't have the capacity to do that. So if you're feeding them once a day, then they can have very dangerously low blood sugars between. I would say any dog, feed them at least twice a day.
So let's say, now, what are the signs to identify if the dog has twisted intestines? What's the proper medical term for this?
The short term is a GDV.
Okay. So how do we identify this? Because the dog can be normal for a while. So I'll tell you, the last case I heard was a dog that was training fine, had no symptoms, it trained, it was fed, and then all of a sudden the dog started vomiting, I think.
Trying to vomit,
and then it was panting heavily, salivating heavily. It went to the vets, they did the scans, and then they identified twisted intestines, but it was too late. They did the surgery, but they couldn't save it.
You're absolutely right. Again, it depends, from the veterinary side, it depends how much it's twisted, because they can sort of half twist or they can twist right round. And what happens then is that they twist the blood vessels, and the stomach actually dies inside, because they cut off all the blood supply to the stomach. And I mean, this is quick. When the stomach twists, you need to be in the vet within 40 minutes, or on the operating table within 40 minutes. Sometimes you get a bit more time, sometimes you get a bit less.
But how do you know?
It's
very difficult to diagnose, I guess.
It's not difficult to diagnose. That's the thing. It's not difficult to diagnose, because every owner of a large breed dog should be aware of the signs, and I'd rather have 3 owners panic and only one of those be right, than 100%. Have 3 owners sit there and question themselves. And please don't social media that, just get down. So with that, what you're looking at with your large breed dog is normally the fact that it's either drunk a lot of water or had a big meal. The dog then looks restless, just a little bit painful, can't settle down. They will often try and vomit, so they go with the sort of movements as though they're about to vomit and they retch, but nothing comes up. You can sometimes see them that the tummy, the actual abdomen, starts swelling and getting quite bloated. Often they're collapsed. Often if you lift up their gums and look at their lips inside, they can be bright red. They go bright red before they go pale in these dogs because it's the absolute shock. It's those instigating factors, you know what's gone on, that you need to get that dog down the vet, and it is an emergency.
I think another one, more than the stomach, is since the weather is there, a lot of dog owners are still taking their dogs out, walking them around 5 p.m. The days have gone bigger, so it's daylight even till 7. So what are the signs where you know this is an emergency? Because they would say, oh, okay, just put water on them or let them drink water. They're panting, but they'll say like, okay, take them to a colder place and then cooler place, and then, they'll calm down. What are the signs where you know that this is an emergency and you do not?
Do you mean heat stroke?
Yeah.
Heat stroke is real. Obviously, we're in Dubai. From that, if your pet, we all expect, and there is a recognised acceptable amount of panting after you've taken your dog for a walk. We've talked before about the heat of the pavements, the heat of the environment, and pets being able to cool down, and pets burning their feet when they're out. But within 5-10 minutes of you coming in, your pet should have settled down and be back at rest. In the same way as if any one of us did an exercise tolerance test, if we go out for a run, you come back and you're heaving, you're breathing hard for the first 5 minutes. After that, in a reasonably fit person, we should be back at that level where we're able to talk and able to function normally.
You start to recover.
Yes.
And this has nothing to do with the size or the coat, because I get questioned a lot because I've got a husky and he's a little mix of Malamute, which I wasn't aware of. Oh, he cannot survive the heat, and they just look at me like I'm torturing him when I take him out for a walk. And for me, I've started to wonder, like, I know that it's not, the dogs don't breathe like us. They don't breathe, from the body, they breathe from the palm. But then is it the same for any dog with the coat, or it differs when the coat is different?
It's most of the coat doesn't actually matter, because dogs actually cool down from panting and from their paws.
They cool down from their paws.
Yeah.
They breathe from their...
But they cool by evaporation, they pant, and they cool themselves down through the panting.
Yes.
So that's not affected by the coat. The pets, therefore, at most risk are the ones with short faces, because their panting is more inefficient. They can't pant as well as you'd like. They have much smaller airways for the size of the dog, a lot more soft tissue in the airways, so they can't cool very well. As far as feet, yes, things like your husky are more adapted to avoid frostbite, which is a little bit different to cooking your feet. So the cooling capacity of the feet isn't quite as good, but they do normally have the good airways to cool down.
Regardless of the coat.
But also, like, when you see the dog starts to pant, and it's not able to recover. And I always feel like the misconception is we need to cool down the dog. When it's no longer about cooling only, it becomes an issue of lung edema, and the lungs are starting to fill with fluids. And
off air, just before, we were talking about the benefits of microwaves and cookers and things. And when you're looking at heat stroke, that's what we're looking at. Imagine that piece of chicken that you defrost in the microwave that starts cooking around the edges because you've ignored it, and it starts cooking around the edges, and it's still fairly cool in the middle. That's what happens with the start of heat stroke. So you see it in the periphery, that the hot feet can't cool down, and that chicken, the edge of the dog is white round, if you just imagine it. And then what happens is you start, within 30-40 minutes of that, you start getting irreversible changes in the dog. So initially they're too hot, but then the body starts producing all the inflammatory mediums, and all the burnt cells, all the cooked tissue within that dog starts producing its own poison and killing the dog. And that's where you get the pulmonary edema and the other issues. There are certain markers in the veterinary world as to how likely an animal is to survive heat stroke, and an animal that is cooled and at the vet within 40 minutes of suffering the incident stands a much better chance of surviving than one that's delayed. So I would always recommend cooling, but cooling
plus
whilst...
vet.
Plus vet, absolutely, plus vet.
Always cooling plus vet. You want to make sure that, and typically, I've been through this, right? And typically, from experience, what happens is, okay, the dog is going down, you're trying to cool down the dog, but at the same time you want the dog to go to the vets, and it needs to be monitored because of internal organ failure. It might need for example, steroids to reduce the inflammation on the lungs, or it depends what you're dealing with.
Some of these dogs can even be at the stage where they're actually seizuring, by the stage where they're actually having fits in front of you because their brains become so overheated that they start to seizure.
And here's another one for you. Like one of my dogs is obviously a brachycephalic dog, short-nosed dog, and what worries me is she's very susceptible to ear infections.
Yeah.
Right, and when she gets ear infections, they typically hit at night.
Of course.
Yeah. There's nothing going on.
Does anything go wrong in daytime?
Yeah. So, and what worries me is because we already know her breathing is very bad and her airways are, very bad, very narrow, and she starts itching from the pain, and she starts panting heavily. Mm-hmm. Right? And all of a sudden, I have a dog who's dealing with, let's say, a minor ear infection that can wait for next day, into a dog that's borderline going into, the lungs are, like she's not calming down, she's breathing heavily, her lungs are going into edema, and
goes
and all
into
of a sudden,
full stress heat
suicidal,
Oh
and she's in the house, she's cooled down, and this becomes an emergency, and this is why I learned not to ignore my dogs when they're, under the weather or not feeling well, or there's something changed, regardless of what time of the day is.
Well, the only daytime twisted gut GDV that I've seen in my career, because they always happen at night, was one that was taken for an early morning walk on the beach, and cool enough weather, everything was fine, but the dog actually had an epileptic seizure. Now, it had the seizure
at the beach itself.
At the beach. But the effort of the seizure overheated that dog, and the dog couldn't cool down, and it turned from having an epileptic seizure to having a twisted gut. And that was because, so the dog got hot with the seizure, the dog then tried to cool, the dog breathed in and swallowed a lot of air, the stomach got so swollen with air that the stomach flipped over.
Oh my God.
And that dog came in about 7:30 in the morning, 8 o'clock in the morning, with a twisted gut from its nice morning walk on the beach. So, these things can happen.
Very painful also for them.
Very, very painful.
So I think it raises questions. When is the time? Because I'm thinking nowadays we've seen a lot of bloody poops as well, and that worries. I mean, my dog literally was pooping blood, and I'm like, this is an emergency and I have to rush.
Yeah.
But obviously at the vet it wasn't. It was just a bowel syndrome that he had. It wasn't anything that I would panic for, but then I panicked. And I'm thinking what are the other things that you would sort of not know? Because again, the parents, now if again he does the bloody poop, I may not panic the same, but then I may be missing out on something. It can't be the same all the time. I mean,
you're absolutely
there's
right.
parvo, there is distemper, all of these are emergency cases and they should not be ignored. But then how do people even know when to begin?
But every case has to be looked at. For instance, that 1-2 cases of diarrhea in a young pup or a young kitten, a bit like sort of dealing with human babies, children, they go down very quickly. So we would always consider a puppy or a kitten with diarrhea much more of an emergency than an adult dog.
100%.
You've then also got the number of times during the day. So if you phone the vets, they should be asking you, okay, how many times has he or she had diarrhea? Have they vomited? How many times has that? How are they? The dog that's had 3 doses of diarrhea that still brings you the tennis ball and asks you to throw it is not a dog that is at death's door. However, the dog that's had 1 dose of diarrhea but is lying in his bed wishing he was dead is an emergency. So, a lot of it is down to that person on the ground seeing their pet and saying, well, how bad do they feel? That really needs to be listened to.
And sorry, go on.
I was going to say, from our side, what I've always taught all of my vets is that when somebody phones up with an emergency, there is a difference between a veterinary emergency and a pet owner's emergency. And what I've sort of asked my vets to consider is that when a client says it's an emergency, then that becomes an emergency for us, because that is an emergency that we've got to listen to.
Yes.
And that's an emergency that, if you consider it as an emergency as a pet parent, we need to see it. We need to look at that.
But would you not tell, because I feel like I would want to educate them in terms of, not to panic. Because owners really do panic. I mean, I had a friend, and Ilyas knows this too, because he was very helpful in guiding, what to do. Because I have no idea of these things. 1 kg of almonds, if you remember. And
Yes.
Now,
who keeps 1 kg?
and it's a multi-mix poodle, a very small dog. He literally
Baffles the mind. How do you eat 1 kilo of
and
almonds?
the stomach, like when they did the test, it literally had almonds, and he was throwing up almonds, and still now I'm thinking, this is an emergency, or is it not an emergency, because almonds are not poisonous, but eating it on this amount is an emergency. But the dog was perfectly fine, went to the clinic, they did the procedures, they kept him in the hospital just to monitor, and he was like, I'm like, come on. I mean, for me, it is sort of like an emergency, but it wasn't an emergency.
I would always treat things like this as an emergency.
There is no stupid question. I'd rather go down to the vet with my pet and know that we'd fixed a problem rather than not go and actually watch my pet die in front of me. We had a client once, really, really sad case. Brought his cat in, lovely cat, and the cat was vomiting. I was convinced that the cat had a foreign body, that the cat had swallowed something stupid that it shouldn't have done. Couldn't see any piece of string, couldn't see anything. And in the end, we treated. The client was very reluctant to go for any sort of imaging or do anything with us, wouldn't let us do what we needed to do. He took the pet home. 3 weeks later, he brought the cat back because, funnily enough, the cat over 3 weeks had lost almost half its body weight, and the cat couldn't eat. Brought it in. I was right, there was a foreign body, and that cat had sat there in agony for about 3 weeks. But the cat had a piece of string that it had swallowed that had hooked in the stomach, and then the string had continued travelling down the intestines. And every time the intestine starts bunching up, that string gets caught, and it tied the intestines in a big knot, and most of the intestines died. And we ended up having to put this 18-month-old cat to sleep, and we could have saved it. Yeah, we really could have saved it.
I always, when I see these things, and the advice here today for me is, don't make medical calls when you are not the expert. If there is doubt, see a vet. Discuss it and listen to the advice. And do the necessary so you don't leave things in the dark. Otherwise, we're going to end up with complications. And, I understand the situation. Sometimes people, fine, we need to save some money, things can get expensive, but, with the test, and they think it's over testing. But, if your vet is unable to give you a conclusion and they really feel they need to do further tests to rule out every other medical aspect that they are suspecting, you have to walk that mile. And save your animal, because I think one of the hardest jobs out there is a veterinarian's job, because mainly we're taking feedback, you're taking feedback from the clients, and you're looking at a creature that with experience you learn to you have your toolkit and how you deal with things, but also the animal is not speaking, So the tests and where medicine is today allows vets to make more informed decisions. And to practice, the practice has improved so much, with the technology around, and still is. But listen to your vets and pick good vets.
I think I was just about to say that this is a very good topic to have in one of our talk shows, that how to pick a vet, because again, there are so many vets. There are hundreds of clinics now in Dubai, but still you feel that people don't have that understanding of, the importance of a veterinary clinic.
I think from that, it is about building a relationship with your vets. It is about building a trust, the same way as we do with a doctor or a dentist. Any of these professions where we feel that we become vulnerable in their care. And that's important for a vet. You need to trust the person that you're dealing with. But, I always say to my vets, any test you want to run should be justifiable to your colleagues, to anyone else in the building. Now, it may be that you're justifying a negative result on the test rather than a positive, but it's still a justification as to why you want to run that test. So you should always be able to talk through to a panel of experts the whys and wherefores, why you wanted to go with that test.
I love this structure, this approach. This is one of the best approach for me, one of the best and the best approach. Because now you have the perspective is not how people think, right? What Dr. Sarah's, I would like to emphasize, and what she's saying is they're doing things from a medical perspective. Even if there is if someone's going to question what they're doing medically, it's being peer reviewed by peers, and it's justified medically why this ABC is happening. Other vets would rule it out. They didn't need to do that. But that's the difference in the quality of the work of the vets. I would rather work with vets who would, comfortably tell me, you're looking at an emergency or you're not looking at an emergency based on our findings and our scientific medical approach, rather than someone telling me, I don't think we need to do that based on, their experience or gut feeling only. I want the informed decision. We don't, I don't like to operate in the realm of, this is what I feel we're looking at only. I feel what we're looking at, this is what our experience is telling us, and this is the scientific backing behind it, and this is what we're going to have to do. This is how things work today. Science has evolved, medicine has evolved, and the process has to take its place. It's no longer, prehistoric approach to things like my grandma would treat my ulcer with drinking vinegar in the morning.
Honey, but it does work.
Stop it.
Come on.
Pure honey. Again, it's very contradicting, because we're talking about animals, thousands and thousands.
For those who are drinking, vinegar, and it's apple cider vinegar.
Apple cider vinegar. I do. It helps when I have an upset stomach, but not my dog. No way on earth. So again, back to emergencies that we're talking about. Anything else that you feel, everybody out there must know that this is an emergency? Because I think there are two trends that we see here. One is that actual emergencies, and one that becomes an emergency because of our negligence.
And one is felt to be an emergency by the pet parent, like the passing blood in the stool, which does become more of an emergency because you're worried. Real emergency, I'd say anything that affects the eyes is always an emergency, because we don't have spares. And
anything that affects the eyes?
Yeah. If it affects your eyes, if you've got damage to the eye, once you've lost your eye, it's gone. So vision's a very important part of what our pets do. It's one of our great senses. So I would always encourage people to make that an emergency. If you think you've got an eye problem, get it fixed that day. Don't wait.
100%.
Other things, like I said, your puppies, your kittens that are vomiting or are unwell with it. Some of that can also be, we see kennel coughs in puppies. Now you think kennel cough, that's just a cough, that's not necessarily an emergency. But we will often see puppies with kennel cough that cough so much that they're vomiting, so much that they can't eat, and those become very dehydrated very quickly. So if your puppy kitten isn't keeping food down for whatever reason, then it needs to come in.
And also they can develop tracheal collapse, no?
Absolutely.
From excessive coughing. And
or they can, or worse still, they can actually vomit and then inhale the vomit into the lungs, and then you have a pneumonia on top of everything.
Yeah.
Which is a hard one to treat.
Very tough complication also.
Down to your bleeding, anything that's bleeding badly needs to be seen.
Yeah, for sure.
The
attacks.
I always tell our clients, because things happen, no?
Yeah.
If you see your dog is having diarrhea or vomit, and if it is a one-off every, let's say, 4 hours, you can leave it for the next day. If it is within an hour or two and it's multiple, no, go to the vet, because you don't want to also lose electrolytes, it's and you go into another emergency and you can possibly lose your dog. And I think dogs lose electrolytes faster than humans too.
They're smaller.
And they can, having 7 or 8 diarrheas in 1 hour is an emergency. And I've seen people leave their dogs with 7 and 8 diarrheas, even if they're over the day. There's something wrong. There's something going on. Don't leave it. Even with vomiting also is another, thing. You lose electrolytes very quickly.
The other thing that I'd say in terms of emergencies is if you're sitting watching your dog or cat vomiting through the day and it gets to about 3 o'clock in the afternoon, go down to the vets then. Because what is always awful is the people who sit and watch their animal all day vomiting diarrhea, decide at 10, 11 o'clock at night when they've been watching it for 12 hours that it is now an emergency, and get them in very, very late in the day. Surely better for everyone in terms of cost for clients, in terms of health for the patient, in terms of not calling vets out for an emergency, to make that call on the emergency at 2, 3 o'clock in the afternoon, see what that pet needs then, and get that pet down to
Agreed.
The vets in the afternoon.
And one of the things that I don't like is people who try to do treatment themselves. The dog's having diarrhea, let's give the dog some yogurt, or let's give the dog chicken broth, and again, you don't know what you're dealing with. The dog can have tapeworms, and potentially, things are going south and it's having diarrhea. I had seen a dog the other day, and we always have this back and forth with the client. I'm telling him, your dog, there's something off with your dog. Every time it comes, your dog has diarrhea, and we send the dog home. We end up isolating the dog and sending the dog home. Right, and until last week, I confirmed the dog had tapeworms. And now the risk, from having like massive worms, and the risk now goes from, something that could have been managed for a very long time into, the heart being affected, the brains being affected, and.
But that's amazing that they didn't notice it when the dog pooped. I mean, our poop is the sign for our dog's health. I mean, the most important topic that we owners have is the dog's poop.
It is, but again, with worms or things like that, it's down to, disgusting fact for you. Every dog, every cat gets worms within the first day of life.
Yes.
When a puppy kitten is born, what happens is that the hormones for giving birth in the mother mobilize worms that have been in their body for years. Okay, so these worms get mobilized, and these worms migrate through the teats, through the milk, into puppy and kitten. So every puppy kitten that the mother's not been dealt with dewormers and everything else, every puppy kitten ends up with worms within the first 24 hours of life. So they take on those worms, and those worms, unless you're doing your puppy protocol of worming every 2 weeks and looking after these guys, every one of those puppies, kittens, ends up with worms in their systems. So if you're not treating regularly, if you're not doing this, then that burden of worms can increase. And if you look at where you are, a small burden of worms animals can live with, and in some cases can be slightly beneficial. But once it goes past that threshold, it can be devastating, and the worm eats first. As you say, the worm can migrate places. The worm can cause issues. We had a dog with heartworm last week. Now, that is actual worms that live within the heart. The problem you get there, if you're talking about heartworms, is that as a vet, when we treat those worms, you have the potential to kill the animal, to kill the dog, because you kill the worm, but if you like, the corpses of the worms can actually get stuck in the blood vessels and cause heart attacks and kill them. So, from regular treatment, regular wormings, and giving your dog a pill every 3 months and treating them with topicals every 3 months versus not, and ending up with your dog unable to travel, unable to leave the country, having to live in a small cage so it doesn't have a heart attack for up to 6 months, and retesting.
And infectious.
And infectious.
And can infect humans at that stage.
Absolutely. It's massive. So, why aren't we treating in the first place?
Same with the tick-borne diseases, right?
Oof, there's some nasties out there, yes.
Yeah.
I personally know 2 dogs who actually passed away, and it freaks me out the minute I see my dog scratching the tummy. And I just go and digging into their fur, like,
But-
it's just...
But most ticks are not itchy. I mean, you're saying scratching the tummy. A tick, when it actually latches on and grabs hold, it has a degree of anaesthetic within its mouth, so they don't feel it.
So what are they scratching for then?
They're
Itching
not
for?
scratching for ticks. They're not scratching for ticks.
Really?
They're itching because they're itching, not because they've got ticks.
You mean to say that the ticks don't make them itch? What?
So, yeah. But actually, if your tick is latched on, then you've got a problem. So better to treat regularly, stop it attaching.
Yeah.
Agreed. So I think for today, like best practice is know your dog or know your pet.
The
Their routines. When things change, don't wait. Check a vet. It's better safe than sorry. And when there's an emergency, what do you want people to do when there's an emergency?
If you've got an emergency, good vets will have their 24-hour cover. Okay. Now, most vets, we were talking about this just before, most vets, like my hospital, okay, we have nurses who are in the building and on call dealing with our inpatients 24 hours a day. Our vets do not spend the overnight in the practice, but they all live within 15, 20 minutes at most from the practice. So if you have an emergency, then call, let the vets know that you're en route. Our nursing staff will get the vets in call and you'll arrive the same time. Our nursing staff and our vets will have coordinated. We'll have all the emergencies that we feel we're going to possibly need for your pet all set up and ready to go by the time you get there. There are, thankfully, very few genuine emergencies that need to be seen within 20 minutes. And whilst we've all watched ER, we've all watched Grey's Anatomy and everything else, we all like the idea of doing CPR on our pets, on people, and we see that on the TV programs. The sad fact is that if your pet has a cardiac arrest outside of a veterinary facility, by the time you get that pet into the facility, more than 90% of those are going to die anyway, or have irreversible brain damage that means you have to put them to sleep. So the animal that is dead at home, if you like, that stops breathing, that its heart stops at home, is unlikely to survive whatever you do with it.
So also another thing is like poisoning.
Yes.
And also, snake bites.
Yep.
We're seeing a few.
We've
You've
seen a
dealt
lot.
with a few also. And how to deal with poisoning, and it's not about leaving the dog and say, let's see if it's fine. Like for example, they eat chocolate, no? And I've had a friend with a dog who ate grapes.
Do you know what?
It's a small dog.
Yeah.
And the dog almost lost its life.
Yeah. Do you know what one of the most poisonous things for dogs to eat is? Chewing gum. Chewing gum.
Wow.
Sugar-free chewing gum. Because the sugar substitute, the xylitol in there, is incredibly toxic to pets. Massively. They have different enzymes and can't use it. But something like taking that pet down, instead of sort of joking that your dog's eaten the box of chewing gum, get it down there, because that dog will need to be made to vomit to get that chewing gum out of the stomach, and that does become an emergency to get that out. With a poisoning, you ideally, some poisonings like chocolate stays in the stomach for quite a long time.
Yeah.
But other poisons, you need to be acting within 90 minutes of them ingesting that poison to reduce the effects.
Yeah.
Chewing gum poisoning, they look fine. Then they will often crash because their blood sugar goes very low. So you'll find them collapse with low blood sugar. What happens then is that the blood sugar goes low because their liver's dying. So you get the blood sugar that goes low, and then they go through this whole irreversible liver damage with it.
What do you call it? What's the medical term for it?
What, hepatopathy?
Yeah.
But hypoglycemia, literally, their blood sugar drops through their boots so that they can be comatose from eating chewing gum.
Wow.
Quite an interesting topic, and sensitive as well. Again, as we say that life and death is in God's hand, but then what we do before that is in our hand, and really urge everyone not to reach the stage where your dog reaches, or your cat, any pet reaches an emergency. It's not really a very pleasant experience. It's not a pleasant sight. It's not a pleasant...
It's part of your responsibility.
It's part of our responsibility.
It's part of your responsibilities, but 80% of accidents can be prevented by prior planning. So if we know more about emergencies that we're looking at, if we recognise problems early, we're more able to fix them.
And like Dr. Sarah said that, always have this discussed with your vets. You have British Veterinary Hospital, please feel free to reach out. I mean, it's something, you don't want to lose your pet, because that grief will not leave. And we all have been through it.
We all lose them at some point.
You do.
But we never want to lose a pet because we could have done something.
Yeah, 100%. Right. I feel very serious about this topic right now. But the next one is going to be a lot more interesting. So again, if you have any more questions, please feel free to reach out, Dr. Sarah, at the veterinary hospital.
The British Veterinary Hospital.
What did I say?
The veterinary hospital.
The veterinary hospital. The British Veterinary Hospital, yes. Okay, the British Veterinary Hospital. Please feel free to reach out, Dr. Sarah. She will be more than happy to help you with any more queries. Or you can leave a comment on the below the video, and we will be happy to answer as well.